Hi, I'm Dr. Robert Wong from Stanford in the VA Palo Alto, and today we're going to talk about some tips in patients with primary biliary cholangitis. So the first question or tip that comes up is, after you make a diagnosis of PBC, what are some key goals of monitoring patients in terms of seeing how they're doing? The key goal in monitoring patients first is assessing their eligibility for treatment, and that takes into account a lot of different clinical factors as well as laboratory factors. Of course, it's important to do a thorough evaluation for liver disease severity, and this includes both imaging-based modalities as well as lab-based non-invasive testing to assess, for example, the presence of advanced fibrosis or cirrhosis. That implicates downstream monitoring in terms of cirrhosis management, but also is very important to assess for treatment eligibility. When assessing for treatment, of course, liver disease severity comes at play, but also looking at liver parameters like liver enzyme testing, and particularly the alkaline phosphatase. The ALK-Phos is one that's important to monitor, not just for assessing eligibility, but also treatment response. And that moves into sort of the next tip we have in monitoring these patients. Once you place someone on treatment, the question comes up, how do I know if they're responding? How do I monitor response? And sort of how often should I be testing these patients? Monitoring treatment response is fluid and dynamic. The keys here are use key factors. One is the ALK-Phos improvement. You want to see ALK-Phos improve, and ideally, you want the alkaline phosphatase to normalize, and that indicates a complete response. Other features in addition to ALK-Phos you should be assessing routinely as part of the comprehensive evaluation are patient symptoms. Patient-reported outcomes, particularly the pruritus, fatigue, these are all very important and patient-centered factors that we should be assessing routinely as well as assessing in terms of response to treatment. Liver disease severity is tricky. A lot of the non-invasive tests, both imaging and lab-based tests, are not well validated in PBC, but it's important to use these longitudinally in monitoring because you can get a sense the direction of change, especially if patients are responding to treatment. And then finally, an important aspect is how we can try and keep patients engaged. A lot of times it's tricky to get patients engaged and continuing to be engaged, especially if their symptoms vary. The key here is consistent monitoring, consistent follow-up, a thorough education and explanation to patients why we are monitoring certain tests, and help them understand the importance of linking these lab and imaging-based parameters to their symptoms. Because for patients, their symptoms and their patient-centered outcomes are the most important. So helping link those symptoms and improvements in those symptoms with therapy, with labs, and with imaging modalities we use are key to helping keep them engaged with their care. And with that, hopefully we've been able to summarize some key tips on how to monitor and engage your patients with PBC to improve their overall care. Thank you for following.